So today we're going to talk about just again kind of where we are with our health data and how we are making decisions as we move forward with COVID-19 and potentially additional restrictions. And we'll talk about also where we are with our testing overview and some updates, especially some updates around how you can hopefully more easily start scheduling testing for students. And then we'll also kind of open it up for questions again, as we think that's usually the most useful information. If you have any questions, please put that information in the chat. All questions should be submitted in the chat function. All right, so here's where we are with the city's data. Sorry. So as of today, our average new case count is 141. So we are currently outside our target of 50 average cases, and we've been outside that target for a few days now. But thankfully, our positive test rate is 2.9% and well below our goal of 5%. And we've been below that goal for now 130 consecutive days. We also have robust testing available throughout our city for our school community, and it's actually prioritized for those in our school community and for our school staff. So though we have a rise in our new cases, that is definitely not where we want to be. Our test rate remains exactly where we want it to be and below where we need it to be, and we still have robust testing available to our schools. So no change to our current school model is suggested or planned at this time. So again, about how we make system-wide decisions is, we've got these health criteria that we've been talking about. And again, if one single criteria doesn't remain at our target, it doesn't mean we automatically shift away from our current school model. Again, we've talked about what those goals are, but there are many options available to us before we make any massive shifts. And so we're not really in a binary situation here with school opened or with school closed. But with many options available, as restricting extracurricular activities, reducing the number of grades served in person, and also reducing the number in our classes, and then potentially, if ever needed, a large-scale change. But again, at this time, we are not making any changes to our current school model. So with our Nola Public Schools data, so right before the Thanksgiving break, the Thursday before we all left, we reported new information. We have not reported information for about a week and a half, and our new information will be reported coming this Thursday, so tomorrow. So about 2 weeks ago, we reported 54 active cases in our school community, 30 staff, and 24 students. And I want us to look at that number and think a little critically about that. Who do we have a lot more of in our system? We have a lot more students in our system than we do staff. Far more students in our system than we do staff members. But we definitely are seeing many more of our staff members being affected. And that's likely from what staff members are potentially doing in their social and personal lives. And so, not only what you do in school matters, but also what you're doing in your personal and social lives also matters greatly. And so, many of the messages we're hearing from the city health department, from our mayor about limiting our interactions, those things are incredibly important, not only to limiting community spread, which is very important, but also making sure that we can keep with our current school model. But I did just kind of want to call attention that we have about 45,000 students in our system and about 5,000 staff members in our system, but more staff members who are currently active cases than students. And I just think that's interesting and worth sharing. So we will provide our next update this Thursday. Again, active cases reflect all cases reported that are still within their quarantine period. And it's not a kind of continuous number. And just kind of like what happened 2 weeks ago, where that number looked a lot higher than what we've been reported in the past few weeks, that number will continue to reflect the rising number of community cases in our city as well. So you'll see that number kind of be aligned with what we're seeing kind of citywide, and it'll be a little bit higher, kind of on track with what we saw a couple weeks ago. All right, so an overview of our testing options. Again, not a whole lot of new information here. Symptomatic and close contact testing is still available through our friends at Children's Hospital, and we'll also be talking about hopefully ways to make the scheduling of that testing a little bit easier for individuals, especially for our school nurses, as well as Ochsner. So that information really hasn't changed much here. Asymptomatic testing, still the drive-through locations available through the city of New Orleans. There is some changes expected with some of the community testing sites that the city manages. And so we really ask you to, before you kind of go to those sites or send somebody to those sites, to take a look at the city's website just to see how those things are changing over the next 2 weeks. But we still want to make sure that everybody knows that there's still robust testing available. We want everybody to make sure that they're taking advantage of it, especially for people who maybe felt like that they maybe spent time with too many people over the Thanksgiving break or traveled to see individuals over the Thanksgiving holiday. Really, they're really push them to go to the asymptomatic testing sites. They're still available. They're free for everybody to use. They're wonderful sites. And so everybody should feel free and comfortable to go and get that asymptomatic testing done for themselves. For Children's Hospital testing scheduling update, Kimberly Buckingham, I went through and kind of put this information that we had here about how we are going to be making an email option available to our school nurses to schedule testing as opposed to just being able to do it through the wellness hotline. But do you want to walk us through this?
Absolutely. Hi, everyone. So yes, we had a rise in our positive cases and our demand for testing. And so our hotline got a little backed up the other week. We appreciate everyone's patience while we worked around that. And we came up with a solution. This is exclusively for school nurses. We don't want to share this email address with with families at this point. So we do encourage school nurses to tell families to use that hotline. But as a school nurse, we trust your judgment in differentiating who needs a test and who doesn't. So we think that you can bypass that hotline. You don't have to go through that screening process, and you can directly email chanolacommunity@lcmchealth.org. The best way to do that, though, is to make it as de-identified of a message as possible to submit that scheduling request. So if you could please leave out any last names or any student grade level, that would be the best from just like a student information sensitivity standpoint. So an example of an email that would be better you could say something like, please call Liz, the parent, at this number to schedule the student Johnny. And you can just leave it at that, and then our testing team will catch that. It has been brought to our attention that not all students have a reliable home phone number to be able to use. So we're working through that option right now. If you do identify somebody immediately that needs to be tested and they have issues with that, I would just advise you to tell them to go directly to our main campus drive-through site. We do heavily encourage everyone to have an appointment that shows up there, but our staff is prepared to handle situations where students might have that barrier with their phone number, and we continue to work on that more. So thanks, Tiffany, for giving us a chance to clarify that, and we just want this to be as smooth as possible for nurses. So feel free to bypass the hotline and send that email. And I'll also say one more thing, the email address is also the same resource to retrieve results the way that we have been doing in Children's is sending a secure email back to school nurses with that information when consent is on file. Thanks.
Thanks, Kimberly. I also was able to make that other additional individual a co-host as well. So I didn't know if you wanted to introduce them and the support they may be able to offer school nurses as well.
Absolutely. Yeah, we can take a moment to do that. Do we have a slide on here with the information, Tiffany?
I did not have a slide for that, but I can put it in the chat.
Yeah, no problem. I can put it in the chat as well. So we do have Patricia Hewen on the Zoom today. Patricia, if you want to unmute yourself and show your screen, would love to just have a minute to reintroduce her to everyone. I know some of you might already know Patricia. She is a huge asset to our school team. She's our school nurse coordinator. She has a lot of experience in pediatrics at Children's Hospital, I think about 6 years at Children's, and then most recently she spent 2 years as a public school nurse and was working at a school up until this October. So she saw the onset of the COVID-19 pandemic and is a huge resource in our ability to support you. So Patricia, I'll go ahead and pass it over to you.
Thank you, Kimberly. So yeah, Kimberly actually said everything I was going to say. So I've been an employee at Children's Hospital for the last 6 years, but for the most recent 2 years, I worked for Jefferson Parish Public School System. So I got to experience the beginning of the school year with COVID, and of course when it started back in March. So I can tell you, I know the challenges you're going through, and I really, really am excited to be here to be able to help you guys. I can't tell you enough how thankful we are for you guys, all of y'all, administration, everybody. I know that these times are so difficult. So I really want you guys to take down my information. I've been in touch with a few people. I haven't been successful with everyone, but Kimberly, if she puts the information, or Tiffany in the chat, please take down my information and be in touch with me. I want to be the resource that if you can't get what you need, contact me. And if I can't do it right away, I definitely have a lot of close contacts internally that can help me get that information to you guys. So I really want to be helpful for you guys. Please reach out. And we want to go beyond COVID as well. So I hope to really be of a lot of assistance from here on out.
Thanks, Patricia. We're so grateful to have you. So thanks for being with us. And I just encourage everybody to reach out to her and use either her cell phone or her email. Like for an example, we had someone reach out today and inform us of a student that was experiencing an issue, even receiving a phone call from our COVID-19 testing team. So she would be a great resource in the future for situations like that.
Yes, Dr. Finger, you're correct. Not close contact is in COVID.
And we will make sure that Patricia's information is sent out with this deck, so everybody will have her details and her information when you get this deck as well. So we'll make sure we send that out. Okay, great. So kind of one other update that we had for everybody is kind of right before the holidays, we talked about the Abbott Binax Now rapid antigen testing that we hope to roll out over the next few weeks. We're still working on a lot of those kind of procedures and methods, kind of protocols that are needed for all of that information for testing and reporting and all of that. So we're still kind of working towards that goal. So, you know, what we're really still working on is, I forget that this has multiple parts. So we're still kind of working on putting all of that information together, but we're coordinating on making sure that we have procedures and documentations that meets the needs of the Louisiana Department of Health, so that schools can begin to hopefully use these rapid antigen tests over the next few weeks and couple of months. So we're creating a set of trainings and supports for schools to be able to use these tests, and building the appropriate protocols, documentations, reporting needs, and agreements that are going to be necessary for schools to administer these tests at your individual school locations. So schools would have seen a survey that would have been sent out by Dina Hasiotis right before the Thanksgiving holiday, and I think she sent it out again the Monday once we return, surveying schools for your interest and being able to be one of the schools that would receive these tests as an initial pilot. So if you haven't filled out that survey and you are interested, please look for that and do so. We're still working on putting all of this information together. As you can imagine, it's a lot to put together to make sure that it's ready for a smooth and safe rollout. So we're just asking everybody to continue to be patient with us as we work through that. We want to make sure that this is a thing that you can really hit the ground running, and that it is, you know, really here for a smooth transition. So we're still working on that. In the meantime, we're still asking that you familiarize yourself with Abbott Binax Now, and educating yourself about these tests, and just frequently asked questions and just general information about these new tests. I'm just kind of looking at the chat to see what we've got here. Okay, got it. And so that's kind of where we still are with that. So if you didn't take an opportunity to do that over your Thanksgiving break, I really actually hope you guys got a break and you took some time for yourselves. So if you did that, kudos. And hopefully you guys take advantage and take a look at some of these videos that we have here for you. And today is really a pretty short presentation because I wanted to see what kind of questions everybody has, but there's a couple of quick updates I wanted to provide. I don't have a whole lot of kind of details behind them. The first is, for those of you who have maybe entered some confirmed COVID cases or suspected cases in the past few days, you would have noticed a new question on the Nola Public Schools COVID reporting form about athletics. We're trying to get more clear ideas and details of when you have confirmed cases that are associated with either student athletes or staff or coaching staff or support staff associated with athletics. So that's a new question that you would have seen in the reporting form as of this week. So it's just there. All you got to do is answer it. We're just trying to get a better understanding of the impact of COVID, especially on our student athletes and our athletic support staff. So that's helpful for us, and we appreciate everybody filling that out. And lastly, many of you may have seen in the last 24 hours, the CDC has been talking about updating and has updated some guidance around quarantine. Dr. Finger is going to give us kind of the quick overview on that, but I think the big thing we want to get across is we are not currently changing any of our guidance at this time at Nola Public Schools, as we're waiting for the Louisiana Department of Health to kind of review that guidance and to kind of file and update their guidance appropriately. So Dr. Finger, you want to talk us through that process and how it works from the CDC updating guidance to that kind of trickling down to the Department of Health for Louisiana?
Sure. Essentially, the CDC makes the federal guidelines, and then each state is able to analyze them, interpret them, and make recommendations based on the science from the CDC, as well as taking into account sort of the operations within each state, because the disease is different, testing capacity is different in every state across the country. So the leadership at the Office of Public Health is well aware of the new guidelines, and I anticipate they'll have a forthcoming announcement in the near future, if not today, then likely this week. I don't think the new guidelines mean we need a change and jump up and down and change anything right now. I think that's the message to all of you. Although there's lots of discussion, I'm sure Dr. Springate and Tiffany's phone exploded today, just like mine did. There's no urgency to it, especially with 2.5 weeks essentially left in this academic term for our school system. That being said, the other thing that we'll take into account when we make the recommendations for the state is what is actually operationally feasible based on the new guidelines. Essentially, this is talking about close contacts and the potential duration and adjustments for the duration of the quarantine. It seems likely that we will decrease the duration of that quarantine from 14 to 10 days. What's less clear is what we'll do with the state with regards to the option to decrease that even further to 7 days with some type of a negative test. So I think we'll cross that bridge when we get there. At this point in time, right now for Nola Public Schools, we're going to stick with what we're doing right now.
Thank you, Dr. Finger. Kimberly, can you help us start walking through some of the questions that we're seeing in the chat?
Sure. So we did have one question that just popped up around Binax now. Could we clarify what that administration process looks like? Does it have to be a school nurse or someone that's skilled specifically for that?
It does not need to be a skilled nurse, someone with an RN. It can be any team member who's sort of learned how to do that and has gotten it and has the appropriate CLIA type of waiver at their school site and partnership. Keep in mind, if someone is, Ben, you want to comment more on that? Since I know you know a lot about Binax.
I guess I would only add that at this time, since the protocols are still being developed in consultation with Dr. Avegno and the City Health Department, who are going to be supporting a broader rollout in the New Orleans public schools of use of this testing. It's anticipated, I believe, that it's going to be school nurses, but who are going to be working in the context of that particular program, but we'll see how the details roll out. Thanks.
And Kimberly, just a little bit deeper into that question, because I've received it from a few school nurses as well. I think it might be a little bit more specific. So they're asking, is this test being administered by the school nurse, or is it happening at the mobile testing children's hospital staff administering these tests? So this is not, Binax now is not the test, I believe, that's being administered at the mobile testing sites, or that are being administered by Children's Hospital.
Great, thank you. We have another question around how to serve the Spanish-speaking community, and this is certainly a topic that has been of much discussion this week, and our team is working on. We did see that there seems to be some feedback from ESL families that they're having a tough time getting scheduled, and we'll take that feedback to our testing team and make sure that there is an interpreter on hand that can have those discussions with the Spanish-speaking families whenever they need to. I
might make that suggestion right now when you guys are sending that email to the school nurse. If English is not the primary language of the family, if you could include that and perhaps even be specific, this is a Spanish-speaking family, that would be fantastic. So we have the appropriate team member making that call to get them scheduled.
Absolutely, that was just about what I was going to say. Thank you, Dr. Finger. And we're also exploring other ways to reach the Spanish-speaking community and offer additional COVID-19 guidance and some assistance on how to leverage our resources and our virtual care platforms and things like that. So we'll have more to come in, with those resources as well, specifically for that community. So thank you for bringing that up, Casey. Okay, we have a scenario question that came through about what the extended quarantine period would look like for a child when the parent is sick. So if mom tests positive, say last Monday on, let's see, that would be November 23rd, Ashley wants to know what her son's date of return to school would be. Would it be 14 days after the mother's 10-day period ends?
Yep, so Ashley, the quarantine period for the student starts on the first day that the mother is able to effectively isolate from the student. So that might be on the first day of her symptoms or the first day that she found out about the test, or it might be when her isolation period ends if she's not able to effectively isolate. Each case is different and there's not a rule on that, but I think you with your school leadership can work to understand best the dynamics of each individual family and case. Obviously, we're not going to send anybody into the house to see if that isolation period is actually being followed, but I think you have to use some judgment to make those decisions. Nevertheless, I think the rule is that the quarantine period begins once the isolation period is effective and or has ended. So does that answer your question? She has not been isolating, so the answer, all right, yes, good.
Great, thanks. And then we have another scenario question that came through from Jamie saying that she has two parents that have tested positive for COVID, and as soon as they learned of their positive test results, they picked up their 2-year-old from the daycare center. The child has been quarantined from his parents. Does the child need to be tested before returning, even if the child will be out for 2 weeks?
The child does not need to be tested, but we're happy to test at 5 to 7 days after the parent's positive test result. So it's not mandatory, but suggest if the parents have the ability. The other thing that I think is important to know, for close contacts, if they come to this campus to get tested, we now have added capacity for the rapid molecular test for those close contacts. So I think that's something we're going to operationalize here. Your families don't need to know that, but you guys can know that we'll be able to test them and give those folks answers in real time.
Okay, and switching back over to Binax now and antigen testing results. Is there any anticipation that criteria around what kind of test results schools can accept will change? There seems to be some concern that this is more work for schools since they cannot accept negative antigen tests. Can we elaborate a little bit more on this process and kind of offer some clarification for that?
Yeah, I think this might be one that Dr. Springate and I can sort of tag team. I think that's correct, which is why any guidelines that come out need to be operational. They can't be sort of pie in the sky things. And we certainly want to make things that make sense for our students and our team members and are actually things that we can do and not things that you need a team of 50 people at each school to do. That being said, there have been some adjustments in some of the recommendations from the CDC regarding the specific type of tests. But again, this doesn't mean that we're going to adopt those necessarily. So at this point in time, we're still considering what adjustments we need to do and are completely cognizant of the fact that we don't want to make a workflow that is actually impossible to successfully achieve for you guys and the schools. Tiffany, did I word that correctly, sort of for how we're thinking?
Well, I do think like with many of the questions that we're getting at with Binax is I just want everybody to understand like we have not rolled this out yet. And so there's more information to come. You're going to have more questions than we can answer. And so if your school has applied for a CLIA waiver, we would want you guys to talk about this because our request is that you don't and that you're aligned with us. So if you have, Dina says that she can respond. Dina, let me make sure I make you a co-host real quick. Give me 2 seconds. All right, Dina, you should be able to unmute yourself.
Great, thanks, Tiffany. Hi, everyone. I apologize I'm late. I don't know exactly what every question was around Binax, but Tiffany was correct. She's down the track of 1, nothing has been rolled out yet. 2, in terms of the world of what a positive versus negative antigen test tells you, all of those things, as Dr. Finger is saying, would be articulated in a protocol. So what we are trying to do, I know if a school, we have surveyed your school leaders over the past week around interest in participating in the work that we are organizing with Dr. Avegno to allow for broad-based use of antigen tests in schools based upon the allocations from the state and some additional allocations Nola PS has received. So nothing is definitive, and schools will need to go through a process of understanding what the protocol is, committing to that protocol, and then we will go forth in distribution and supplying you with that information. Schools can technically apply for an independent CLIA waiver, but in reality, that should be, we need to be aware of that because we're actually talking directly to LDH about what's appropriate for the parish versus independent charter schools. So if you are a school that has applied, I believe I know of those that have, and we're working with them on a one-off basis, please contact myself, and Tiffany can share my email message after this. But the goal is things are going to get more complicated as more testing infrastructure is available, and the testing dynamics are changing daily, nationally and locally. But our hope by creating some systemized consistency from where we're sitting around expectations, protocols, and training, you all would be informed and then be able to leverage one another in a support network. That is why we want to do this together, not independently, and that's the expectation NOLA PS has. So I don't know if that directly answers that question, but I think everyone should know that we are moving forward, but nothing is implemented now and there's no expectation for use at this date. But prior to Thanksgiving, we flagged that we just wanted you all to start to get to become familiar with those materials through the training resources. But the work that we're doing at the parish level would be much more kind of organized in the rollout and training and support related to that testing infrastructure.
Thanks, Dina.
There still seems to be some confusion around the benefit of leveraging Binax now as a resource if it's not something that is a comprehensive solution. Like it can't, this doesn't stop the decision tree if you get a negative test. So should we spend some time talking about the benefits of continuing to use that once it becomes available, or should we just wait until the time?
I think once we've developed the procedures where we define the methods by which it's actually going to be used, it's going to be a much more fruitful conversation, which we're still working out with LDH and all the waivers and different applications for its use.
Perfect. Okay, so there's another question that came through that says it seems that whenever families are reaching out for COVID-19 medical guidance, they find that the isolation or quarantine information is given to the individual of interest. It's not necessarily advice for the entire family pod. So how, Dr. Finger and Dr. Springate, how can we advise schools to help the whole family pod in situations where they have questions or there might be multiple cases going on? or how would you advise families get holistic advice?
You know, they can call the hotline, but overall, the approach is to, if you can't effectively, is the question about if someone in the family is positive and there's other family members who are close contacts, Kimberly, how to approach that?
I don't know what the specific scenario is, but I think that's a good example to go off of, is just how are other family members affected and what should they do?
Yeah, so I think if there's other close contacts and we don't have the capacity to effectively isolate the positive individual in a room for 10 days, then the other mitigation things that we do in our community, you can also do within the house if you're in a shared space. Like that person who's positive should keep a mask on when they're around their family. I think some of these are maybe obvious to us on the phone, but might not be as intuitive to many of the families that send kids to our schools. And all those things you can do that you do in the community, washing your hands, you know, trying to not be out when you're coughing stuff up, is appropriate to sort of reiterate. Our hotline can certainly give that information. And I think that, do the best you can.
And we just continue to encourage families to ask those kinds of questions when they reach out to our hotline. I know that it's a difficult concept to kind of think through, how long the quarantine period needs to happen after isolation period ends for a positive family member. And so we're working through that as a team as well. So thank you for all the explaining that you have to do for families.
I did get another question privately to me. Can we walk through again what is necessary for a student who has received a positive COVID test before they can return to school? What criteria must be satisfied? We want to make sure that that's clear that one of those criteria is not necessarily a negative test. That is not required for a student to return to school once they've been classified as positive. So Dr. Finger, can you talk us through what those criteria are for return?
Sure. If Johnny tests positive on Monday, this past Monday, the first time he is released from his isolation, the earliest is 10 days from the first date of symptoms or positive test. So let's say he had symptoms on Monday, add 10 days, and his symptoms need to have been improved, and he needs to be fever-free for 24 hours without Tylenol or Motrin. If he meets all three of those, his isolation is removed. So sometimes that's 10 days, sometimes it's 2 weeks, sometimes it's 3 weeks. All three of those, there is no requirement to have a negative test result documented.
I had a question that was privately sent to me as well. If we could get some type of information for families once they get their test results, because apparently it's pretty shocking when they're informed that there's a 24-day quarantine period for any siblings or anybody in the household that cannot properly isolate from someone who's tested positive. So we'll take that feedback to our testing team and see what kind of conversations are taking place with families. I'm sure that's verbally reviewed, but we'll see what further information we can provide.
Really, it might be helpful to just give a copy of our Patricia to the nurses team, but what we give is essentially that. But yeah, if we could just get a copy of the language that our nursing hotline team and our testing team uses when they speak to families.
Absolutely, I think that would be really helpful. We'll make sure to share those documents. Okay, so as we approach the holiday season, as I review the rest of the chat box, do we want to spend some time talking about some key reminders throughout the month of December for families and for schools to keep in mind, and what some of the biggest pivot points are going to be?
So, we've gotten through the Thanksgiving holiday, and I think what we want to make sure that we are asking schools to do, and school nurses, you are, again, on the front lines, not only of, what is appropriate to do within schools, but also I think you hear from staff about their social lives and their interactions. And I think really our goal is to make sure that we're all minimizing our interactions, not only in the school building, but also in our social circles. And so I do think it's as important as COVID fatigue is very, very real. as we can all be ambassadors of the messages that we all want to keep our circles very small and within our immediate family units as much as possible. Also, I think we're all getting a little bit more laxed in how we interact with those that we are most comfortable with in our work settings. And especially, we know how demasking may be occurring in our break rooms, in our, lobby spaces, front offices. And I think, as we see so many of our staff members having, positive cases as opposed to our students, I think our adult behavior on our adults are the ones that we're definitely also very concerned about, and making sure that we're all just practicing and promoting good behaviors. Social distancing, masking, washing our hands. It's so simple. It's so repetitive. And I know we're all so sick of hearing it, but it all really, really matters. And I think in the next few weeks, it's going to really matter as well. So I think on the school side, it's really, again, always the basics, making sure that we're reporting information quickly to the Department of Health and to Nola Public Schools so that we get the information we need for any kind of future decision making. I think if you guys have any questions about close contacts, I think, some of you gotten very comfortable with reaching out. For those who haven't reached out, feel comfortable in reaching out to Children's Hospital as well as the Nola Public School staff that you're comfortable reaching out to for questions, as we want to make sure that the data is right, because the data is driving so many of our decisions. So quick reporting is very important, as it really influences our day-to-day looks at the data. Those are kind of the most two important things for me. Dina, I don't know if you have any kind of thoughts or messages you would want to share with school nurses as they're kind of on the front lines of their schools.
Well, I just want to say thank you. I think Tiffany is saying that on behalf of the system. I think also on this work, I think we've said over and over again, you have been on the front lines, and as of now, more and more you're seeing it, and we know that you're having to field a lot of concerns and anxieties and fear that is real or just sort of potential around what's happening in the community and at school. So I just want to say thank you, and I want you to know that the work we're trying to do centrally is to support you all in this effort. And so connecting with us and letting us know when you need support and how we can do that, given the vital role you're playing on behalf of really our entire community, is extremely appreciated.
Tiffany, just going back to what you just mentioned about the reporting importance, there was a question that came up around whether schools can whether it would be acceptable or appropriate for an individual school to reach out to their parent population and update them on what their school's current COVID case count is, the same way that Nola Public Schools is doing on a broader scale. What do you think about that kind of correspondence?
I think we have a few schools who are doing that proactively. So, schools are required to send a communication to their global school community whenever there's a positive case. And then you're required to send communications to those who are close contacts, defining their quarantine period. I think we've also seen some schools go a step further, where they are, maybe a dashboard is too fancy of a word for it, but where they are kind of routinely and consistently updating their entire school community on kind of a set day every week on kind of just what's the status of COVID in your school or their charter management organization. And I think that that does not hurt because communication is a very effective tool. Transparency gives people confidence. And so I think that it is very effective. So I'm not sure if the question is that, or if the question is, as opposed to sending a school community message each time there's a positive case, can I just do that once a week with a tally? I think that's dependent on your school community. I would hesitate to do that. I think that, sending that email every time that there's been an identified confirmed case is probably helpful. I think if in a single day you've had multiple, maybe waiting until the end of the day to report multiples, but I wouldn't wait a full week, because what you also don't want is a rumor mill to get created and people think you're being unresponsive. Because then I think that leads to a lot of negative emotions that you just don't want. And so I think waiting to the end of the day so that you're not sending multiple emails a day makes complete sense. but I wouldn't hold on them for a whole week, as I think it might be counterintuitive and might start, rumors and other situations that will be counterproductive.
Great, thanks, Tiffany. Dr. Finger and Dr. Springate, as far as how holiday events at school should be managed, I know that schools are probably trying to stay away from this, but if there is any type of gathering of students or any type of event in a classroom around decorating things or maybe even bringing in food, how would you advise these situations are navigated in order to continue to acknowledge the precautions?
I'm going to be honest. There should not be holiday events. Anything that includes any congregation of people beyond what is already happening in the course of daily school operations should be discouraged and avoided. And I'm not, apologies that I have to wear a mask at this moment, but I'm not trying to discourage celebration of the holidays by any stretch of the imagination, but we're heading into an accelerated period of increased cases in our community and nationwide at this point. And gathering together for celebrations with, in any way that is beyond what is needed in the context of day-to-day work life or other day-to-day activities is really discouraged. So, if it's already a group that's in the classroom together, they already do everything together because that's part of their daily school operations, then some type of activity that does not extend or expand their range of contact might be appropriate. But otherwise, there should not be any other celebratory activities or congregations.
And so that applies in the school environment and also at home, right, Dr. Springate? Thank you. And there seems to be a conception, perspective amongst individuals that have tested positive for COVID-19 and then recovered, that maybe there can be relaxed, they can be more relaxed around wearing their mask or being around larger groups. How do you advise schools to tell families or students that have had someone that's already recovered from COVID-19 to continue taking precautions?
Very simple. They need to continue doing everything as is. There's no adjustment for individual students or team members who have had COVID to the guidelines and mitigation strategies that are currently in place.
And do we have any updated information around what reinfection could look like or probability around having COVID-19 twice?
There's no new information on that. The data is relatively reasonable that the initial infection confers some degree of immunity for a period of time, but we're 270 days into the local spread of COVID-19, so we don't have information that's longer than 9 to 12 months, certainly. That's why we stick to the same mitigation strategies, regardless of if you've had it or not.
Last question about the holidays. If there are families asking schools or even staff members at schools that do plan to travel over the holidays, is there any advice we have around what they should take into account leading up to that travel or whenever they get home? How can people make arrangements so that they continue to mitigate risk inside of their own households as well as who they surround themselves with at work?
So I think someone on this call said it once a couple weeks ago, pretend everyone outside of your nuclear family has COVID-19. So if you can go somewhere and effectively socially distance from everyone else, knock yourself out, go to the woods. If you're gonna go to downtown New York City, or think of crowded city X where you're just gonna camp out in Times Square, is probably not the best option for a holiday travel.
Okay,
I guess I would add that the CDC has, I saw as recently as today, asked that everyone please cancel holiday travel. I recognize that is not something anyone wants to hear. I do not expect 100% adherence to that in our community or in any community. I'm simply acknowledging that if we really want to think through, what does it take to keep schools open? What does it take to get back to our daily lives? What does it take to interrupt this pandemic? people have to make some sacrifices, and wearing a mask is one type of sacrifice, but also doing things like rearranging holiday plans is another really critical part of the process at this point.
Thank you. Okay, so we're getting down to our last 10 minutes. If anybody has any other questions, please get those into the chat so that we don't miss them during our remaining time. Otherwise, Tiffany, do you have anything you want to close on with our last 10 minutes?
Nope. I'll update this last slide for those who joined maybe a little bit late so that you kind of know what we were actually giving in these quick updates. So those who joined a little bit late, we added a question about student involvement, we added to our Nola PS COVID reporting form a question about, were those positive cases student athletes, are also associated with the staff or coaching staff that also support athletics, as we're trying to gather more information about COVID-19's impact on our athletic programs. Also, the CDC did update quarantine guidance recently. Though that update did come today, we will be not instituting any revisions to our current guidance until that is adopted by the Louisiana Department of Health. And so that, just no changes there, though I know that's a big deal in the news right now. And so just hold on that. You got somebody who says, I'm a close contact, but I just got a negative test and I want to come back to school early, it's a no, until we get that updated guidance from our state. So there's no changes there. Also, I didn't put this in here, but there are a few members of us who will be serving on the city's vaccination working group. And so hopefully over the next few weeks, we'll have more information to share with you about the vaccination process that will be underway in our city. So we'll be able to share hopefully some information with you guys about that over the next few weeks. So we're excited to be able to participate in that with the mayor's office. So more information to come there as well. When I send the deck out, I will also be sending Patricia's information so that if you guys want to contact her with some specific questions, you'll have her direct contact information, as well as Dina's email. If you have applied for a CLIA waiver and we are not knowledgeable about that, please let us know, because we do want to be coordinated. These things are complicated. The protocols are complicated. The reporting is complicated. We want to make sure that we're doing these things appropriately and doing them together, as we have resources helping us draft these things, and we want to make sure that you're taking advantage of them. So I'll also include Dina's email, and then if you have applied for a CLIA waiver, which we really are discouraging and asking you to do it with us, please let us know. I also am seeing a question that if guidelines changed if both parents tested positive. There's been no change to guidelines. I think what we're seeing is people are getting clarity on the guidelines. If both parents or a single parent caregiver situation has a positive test, the child of that two-parent situation or the caregiver cannot begin their quarantine until the individual who is positive has completed their isolation period. So that's a pretty long time. And that is not new, but I do think people are getting more clarity on that. And maybe that was misunderstood before. So you cannot begin your quarantine if you are a close contact living with somebody who is effectively in their isolation. Quarantine cannot begin until isolation of the infected person has completed. I hope that answered your question, 789-531.
Yeah, so of the few questions that did just trickle in, Tiffany, I think you answered all of them. The one about the vaccines and the CLIA waiver, as well as the guidelines for parents testing positive. There is one question around, is this a scenario, if a child has a runny or stuffy nose, has a negative antigen test received, then the student should be cleared to return without a doctor's note. Dr. Springate or Dr. Finger, do you have any extra commentary on that?
Yes, that's incorrect. They can't be cleared with a negative antigen test without a doctor's note or a negative molecular test, which we offer here, and you'll get same-day results.
Great, thank you. So I think that's about it for the questions. I will appreciate everyone's feedback they offered on testing scheduling and barriers that some members of our community might run into with either language or access to phones or virtual resources. We are taking all that feedback and working through that. As Dr. Finger mentioned, whenever you submit a de-identified scheduling request over email, please emphasize if you are aware that it's a Spanish-speaking family so that we can get on the front end of that and make that a smooth process for the family. And then we'll also work on making sure that we have the same materials that our COVID-19 testing team is sharing with the community when they get tested with school nurses so that you can have that same reference point. And okay, there's one last question that popped in about whether you need to pick one major or two minor symptoms in order to make a decision on the decision tree. Can we elaborate on what that symptom selection process has to be?
Any of the constellation of symptoms, even a single symptom, I would strongly suggest getting tested with the increase in community prevalence at this point in time and our ability to access rapid molecular tests with a high degree of ease.
And that's it for questions, Tiffany. Thank you, everyone.
Thanks, everyone. We'll get this deck out to you shortly. Have a great day.